Testing, testing. Good day and welcome to another edition of Living Well with Adena. My name is Dr. Kataka and I'll be your host today. Well, it's officially fall. The kids are back in school and the holidays are among us. And in a normal year, that would mean flu season. And we're joined today with two expert guests. They've been with us before, so we're thrilled to welcome them back to talk to us a little bit about what's different this year and how COVID has impacted us. You know, there have been now over 290 million people infected worldwide and nearly 1 million deaths. So it's a different time that we're living in, and we want you to be able to understand what are the similarities between COVID and the flu, what's different about the two, and really, most importantly, what do you do and how can you tell the difference? And so we're thrilled, and I'll introduce my guests here in just a second. We also want to remind you that we want your questions and your feedback. So if any of you have questions, please put them in the comment box section below. We'll be happy to get those for you. We have staff that are on standby that will be able to bring those questions to our wonderful guests. Without further ado, I'm going to introduce the two guests that are with us today. We are rejoined again with Dr. Dane Black, who's the medical director of Adena's Urgent Cares. Welcome, Dr. Black.
Good afternoon.
Yeah. And Dr. Amy Maggard, a pediatrician with Adena Pediatrics. Welcome.
Thank you.
Dr. Black, why don't you tell us a little bit about yourself and your background for those of you who may not know you?
Sure. So my name is Dr. Dane Black. I am the medical director of the Adena Urgent Cares here. I'm originally from Gallipolis, Ohio, so I am from Southern Ohio area. Moved up here with the family about 2 years ago and been enjoying it ever since and plan on staying long term.
Fantastic. Tell us a little bit more about Adena's Urgent Cares. How many are in the area?
Sure. So we now have 5 urgent cares open. We have the Western Avenue Urgent Care, which is across town over by like the Kroger at Western. We just recently opened an urgent care in Circleville, which is as of this summer brand new, and that's been ramping up quite nicely very quickly. We have, of course, the urgent cares both in Hillsborough and in Waverly that have been there for quite some time now. And we also manage a walk-in clinic that's at Walmart as well. That is, by the way, back open again. That was closed for some time due to COVID.
I've heard that the urgent care in Circleville has been doing quite well. Mm-hmm. Now, is that the one that's located near the Buffalo Wild Wings in Circleville? Mm-hmm. All right, perfect. What are the hours if someone was interested in attending or going to an urgent care? Sure.
So all of our urgent cares are 8 to 8 with the exception of Western Avenue, and that is 8 a.m. to 9 p.m.
And is that Monday through Friday, or is that every day of the week?
That is 7 days a week.
All right.
362 days a year, I believe.
Gotcha. Okay, so close Christmas,
Thanksgiving, and New Year's.
Okay, so a lot of access for folks, which might come in handy here after we talk about some of the nuances between COVID and the flu. Dr. Maggard, tell us a little bit about yourself as well.
So my name is Dr. Amy Maggard. I'm a pediatrician here with Adena. I've been here for just over 2 years. I work at the Waverly outpatient site 3 days a week, Monday, Wednesday, Friday. Chillicothe on Tuesdays. But I'm also from the area. I grew up Athens, Ohio, so it's nice to get to come back home to practice.
That is awesome. So we have 2 Southern Ohio folks who are from the area and are now practicing medicine, which is really a testament to the educational system in our area. And we're thrilled that you both have decided to stay in the area. And Dr. Maggard, your practice in Waverly is located right off of 23.
Yes, yeah, it's right at the bottom of the hill, underneath where the Pike Hospital is. So right at the bottom there is the building. It also has family practice, internal medicine, and urgent care. Mm-hmm. So we're there as well now on the 2nd floor.
Thanks for sharing that with us, Dr. Maggard. We appreciate that. So Dr. Black and Dr. Maggard, let's dive right in. Right. So Dr. Black, I'm going to start first with you. Let's talk a little bit about COVID and give our viewers an update. We do know that urgent care testing, they've done COVID testing, and there was a significant shortage of supplies as the pandemic first played out. Can you give us our audience an update about testing? How are the supplies coming along? Is it hard to do? Mm-hmm. Walk us through those steps for us.
Sure. So if many of you may remember, early in the pandemic, it was extremely difficult to get a test. You had to be over 65, you had to have chronic health conditions, or you had to be, working with a healthcare facility or first responder type situation. That is the complete opposite of the situation currently. So now virtually anyone, symptomatic or not symptomatic, can be tested at this point in time. And soon, in the next, hopefully, couple of weeks, knock on wood, we will have rapid testing here available at Adena at all of our urgent cares as well. So instead of waiting, anywhere from 2 to 7 days, depending on the situation with these external labs, you'll be able to have results of these tests in 15 to 20 minutes after being swabbed.
That's awesome. So you can find out before you probably even leave the building then.
Exactly.
Can you, for those who might not understand, so what's the difference between a rapid test and one of the other tests that took 5 or 7 days to get back?
Sure. So on standard testing that has been done through the Department of Health and through our other labs was PCR testing, which is a more theoretically accurate test, albeit these current testing units that we have are essentially mini PCR machines. So the accuracy should be on par. It's touted as essentially the exact same accuracy as some of these other ones. So where you see a lot of those reviews like, oh, rapid testing misses a lot of cases, that should not be the case with the ones that we're acquiring.
Okay. So now we've covered a little bit of a review of where we're at with the COVID testing. And I'm sure there's a lot of information that our viewers have received about COVID. But we might take a step back here and do a refresher on the flu, right?
Mm-hmm.
So Dr. Black, can you kind of walk us through and tell us about what is the flu virus? So when someone says the flu, what do we mean medically? Sure.
So influenza is a respiratory virus that we've been, dealing with since the beginning of historical medical time. It is seasonal, so typically that will start happening around October. We'll start seeing our first cases, and then it usually peters off in the later spring type area. So influenza is typically causing about 35,000 deaths per year. Given on the year, we've had as little as 12,000, as many in the last 10 years, as many as 60,000 deaths, but usually around that mid 30,000 range. So it does have an effect on people. It is an upper respiratory virus, meaning that you're going to get symptoms such as congestion, cough, sore throat, oftentimes body aches and fevers with those as well.
So I've heard, or folks may have heard about the different types of influenza.
Mm-hmm.
There's an A and a B. Should that matter to our general viewers?
Sure. So those are the two major subtypes of flu. There are many others. So whenever you're hearing about whether a flu shot is efficacious that year or not, we're really trying to match what we think the flu subtypes will be. So A and B, not a huge difference in symptoms when it comes to that.
So here's a question that I get asked a lot. How effective is the flu vaccine? Or really the question is, how good is it?
Mm-hmm.
And it changes, it seems like, from year to year.
Yes.
Can you walk us through that and why?
Sure. So as we previously talked about, we're really trying to guess essentially each year, or not we personally, but whenever they're formulating these flu vaccines, is they have to estimate what they think will be the most common subtypes of the flu. So it could be as little as 20% effective or as high as recently 60-70% effective, just depending on how well we guess for that year.
So now we've talked a little bit about effectiveness.
Mm-hmm.
I'm going to start with Dr. Maggard. Who should be immunized with a flu shot?
So as far as pediatric goes, any child 6 months and older can get a flu vaccine. And it's really important to get your kid immunized against the flu, especially for the younger ones, 5 years and younger. They've been shown to have more severe illnesses with the flu. And it's a little more harsh or significant to them than other types of respiratory illnesses.
So you actually start at 6 months of age.
Mm-hmm.
So is that done in part of a routine well-child check, or is that something that they should bring in, let's say, a child is exactly or just turned 6 months?
Yeah.
What would your recommendation be there?
So if they're there for their 6 month well, they can start their flu vaccine with their other immunizations as well. You can also make a shot-only appointment, so to come in just to get the flu vaccine. And also, if you're there for any other illness, even if it's a cough or congestion, you can still get the flu vaccine. Mild cold symptoms are not a contraindication to receiving the vaccine. So really, for any appointment you have, now that we have flu shots available, you can get your flu vaccine with that.
So let's review, because I think there's really a couple key thoughts there that you shared. Number one, you can get the flu, your child can get the flu immunization with other immunization.
Yes, yeah. So
Okay.
it's safe to give with other vaccines as well.
And then the second important point is you do not have to be perfectly healthy to receive the flu vaccine. You can have mild symptoms from something else.
Yes, you can have other symptoms. You could have cough, runny nose. You could have an ear infection even beyond antibiotics, and it's still safe to receive the flu vaccine.
I think that's a great take-home message for our audience. So Dr. Black, we've heard from Dr. Maggard regarding the pediatric population. I'll turn the same question over to you. Who should be immunized in the adult population?
Yes, so really from our standpoint, anyone over 6 months of age should be immunized, particularly people who have chronic health conditions, who are pregnant, who may be taking care of someone who's chronically ill, and especially elderly folks with chronic illnesses in addition to that.
Okay, so there's some key folks that are really even more critical they get the flu vaccine.
Sure.
You mentioned people over 65. Is the flu shot different for them?
Yes, it is. So there is a high dose once you hit that 65 age, and wherever you go to get your flu shot, obviously they'll be asking your age, and that should be something that automatically should take place whenever you come. I know that's something for us that we do, is if you're over this age of 65, you automatically get that high dose flu shot.
Got it. So it's not something that the average person needs to specifically ask for. I gotcha. Well, I get this question a lot as well. What are the side effects from a flu or flu immunization? So let me start with you, Dr. Maggard. What do you see commonly in children?
Yeah, so the flu vaccine, its job is to boost your immune system. So it's almost like tricking your body into thinking it might be infected. So with that, sometimes you can have a little bit of aches. You can have fever. You can be a little fatigued, almost like a small illness itself. But fever, a little achy, a little more fussy in kids, that's totally normal following the vaccine.
Okay. What would be your recommendation to a parent or a caregiver of a child who just received their flu immunization in treating some of those symptoms? Would you treat at all? And if so, what would they use?
Yeah, if they're okay, if they get a little bit of a fever, but they're active and playful, you don't have to treat the fever. You can watch them. If they're more fussy or really uncomfortable, you could use Tylenol or Motrin. If they're over 6 months, you can use the Motrin. Under 6 months, they shouldn't be receiving the vaccine anyway. So. And
a parent or caregiver could certainly talk through with you or their caregiver about what the appropriate doses would be. And
absolutely,
all that.
Yes. Yeah.
So Dr. Black, is that similar for the adult population as far as the side effects from a flu vaccine? Absolutely.
So you'll see essentially mild flu-like symptoms for the next 24, 48 hours after the vaccine. So you always hear people, well, I got flu after getting the flu vaccine. Well, sort of. You got a very, very mild case, which is actually the point, because that means your immune system is functioning appropriately, fighting that virus, and you're getting that secondary immunity a couple of weeks after you've received that flu shot.
Isn't it true, though, doctors, that some people get the side effects, but many folks just feel fine right after? Is that true as well?
Yeah.
Correct.
Yeah, you don't have to have side effects. You could have none, but if you do, those are the most common ones you would see.
And Dr. Black, can folks just go about their business after they've gotten their flu vaccine? Do they have any restrictions or anything like that?
Nope.
No. Fantastic. Fantastic. What if someone has let's say a grandmother or a friend that's in a nursing home? What would be the recommendation there regarding both the person that's in the nursing home for immunization and perhaps for the person that would like to try to visit or come by and say hello?
Yeah, so absolutely before going to a nursing home, we would recommend you've had the flu shot for at least 2 weeks. Again, that way you are getting immunity from the flu prior to going to any of these high-risk areas. I would also say that applies to anybody that has that's going to be around very, very young children, particularly less than 2 years of age. If you're around any of these high-risk patients, we highly recommend that you get that done.
So thank you so much for taking us through the immunization process. I think this is the real critical question that folks have out there, differences, right? So we have COVID out there. We've got the flu that's going to be out there. As you mentioned, it starts in October usually, and well, it's right around the corner. So can you kind of educate us a little bit about the differences between the spread of COVID and the spread of the flu, if any?
Sure. So COVID in general seems to be a much more contagious disease. We often find these super spreaders you may have heard about in the news where one person has it and affects, tens of other people, up to, and secondarily, hundreds of other people by one case. So it's a very highly contagious disease. thought to even be in respiratory droplets, not, aerosolized in the air, not just, cough or sneeze type droplets, which makes it a lot harder to contain in comparison to the flu, which, more often than not is contained in, a little less. Not one person isn't infecting, hundreds potentially with one case of flu.
Gotcha. So I heard you say droplets and aerosol. So if I understand it correctly, so correct me if I'm wrong, the droplets are bigger and heavier and they fall quicker?
Correct.
But the aerosol, I think of it as a Lysol spray, right?
Exactly.
It kind of goes out and it's a thin mist. Is that a good example?
Yep. In fact, that's one of the hardest things to control is those aerosolized viruses, because they can potentially be in the air after someone positive comes through for up to 2 to 3 hours after they breathed them out.
So here's the trickier question, Dr. Black, and then for you, Dr. Maggard, as well with the pediatric population. How are we going to tell the difference? How do I know if I've got COVID or if I've got the flu? What are your thoughts there?
So generally, the correct answer is a lot of people do have mild symptoms from COVID. So the best answer for that question is to test. Albeit for COVID type symptoms, frequently you're going to have more symptoms of what we call lower respiratory symptoms. So whereas upper respiratory is the nose, the throat, maybe a slight cough with the flu, COVID on the opposite hand will be more lower respiratory. So you'll have a deep cough, you'll have shortness of breath, difficulty breathing. And one of the things I'm sure you've heard about that's more of a COVID type symptom is that acute loss of the sense of taste or smell. That's fairly uncommon to other illnesses, other than maybe some nasal congestion, but usually you'll still have your taste and some smell with that.
Gotcha. So if you feel sick and you suddenly can't smell the candle or the lasagna baking, that should be a little ding that goes off that says,
exactly.
I might have a difference here between the flu and COVID.
And that's the real unfortunate thing about COVID in general, is sometimes that's literally the only symptom we've seen. People have come in, they're like, I'm a little congested, but I can't taste anything. You swab them and they have it, and that's really all there is to it. The unfortunate aspect is that person can then go and pass that to someone who is higher risk, who may not have as good of an outcome from that disease.
So Dr. Black, is that another difference as well? With COVID, we have seen a wide spectrum of symptoms manifest, from didn't even know they had it to really, really sick. And, of course, some folks are unfortunately in the ICU intubated. With flu, do we see that? Do people walk around with flu going, I didn't even know I had the flu?
I would say less likely that that's the case. A lot of times people just think they have a small cold. I mean, you do get mild flu cases occasionally, but certainly not to the extent, I think, of the true dichotomy, the differences between how mild versus severe COVID can be. I mean, flu, as we've said, the worst flu season we've had in the last 10 years was a couple of years ago, 61,000 deaths, I believe. And I mean, we're already at 200,000 deaths this year from COVID. So obviously, it's a much more deadly disease than flu is in that respect.
So Dr. Maggard, this might be a good time for our audience for us to just take a slight step back and remind the audience, how COVID affects the pediatric population. We've heard in the news and other reports that it tends to be more severe and affect the older population. But can you just give us a quick refresher about what we should look for with COVID in our pediatric patients? And then can you help us is there a way to tell the difference?
Yeah, that's a good question. So we've been seeing that COVID doesn't seem to affect kids as bad as adults, especially older adults. Now, little kids, especially under 1 year infants, they do kind of struggle more so than the bigger kids, but again, not as much as adults. It still can be life-threatening, but really compared to the flu, it's been less deadly or less severe in kids. And with that, the symptoms can be really similar. You can have cough, runny nose, you can have fever, you can have body aches. And in our little ones, a lot of times they can't tell us if they have that loss of smell or loss of taste. So that can be really hard to distinguish. So again, like Dr. Black mentioned, a test is really how we would know the difference between the two.
So let's kind of talk through that, Dr. Maggard. So what's the process then? We have a viewer at home, right? They're not sure if their child has the flu or COVID, but their child is sick. They have a fever. They're not eating well. They're really fussy. Is the first step calling you, Dr. Maggard, or is it just showing up? Walk us through what would be the best steps for a parent to do.
If your child has cold symptoms and you're concerned and you want them to see, I would call the office. Let them know what's going on, schedule an appointment so that they can be seen.
So the office is going to help walk them through some of the steps and what the recommendations are?
Yep, they'll walk them through the steps in the scheduling process.
Let's say it's determined then that you feel that the child should come into the pediatrician's office. What can they expect?
Right now we're doing rapid rooming, so nobody's sitting in the waiting room, or they shouldn't be for more than a couple of seconds as they check in. So they get put in a room right away. With little ones, it's important to maybe let them know about the mask. It might be surprising if you kept them home not around other people that everybody will be wearing a mask. But they'll come in, they'll get roomed, then the nurse will come to the room, get their vitals. Then the physician or the practitioner will come see them and evaluate them.
Okay. So thank you. I think that's very helpful. And then if they need a test, right? You mentioned tests, both of you have mentioned the tests are important. Would that be performed right there in the office? Can you kind of give us an expectation there?
So the flu swab we can do in our office right now. And it's pretty rapid, 10 or 15 minutes we have the results. So that's a good first step in these illnesses, is to determine if it's the flu. And then for a COVID test, what we do, once we've evaluated them, we call a number, we get them on the schedule, we go over them and give them contact info, then they will either give us a scheduled, slotted time for them to go get swabbed, or they'll call the parent directly and let the parent schedule that themselves.
Okay.
And then they can we've been sending them to urgent cares, where they do a car swab for the patient.
Oh, so Dr. Black, let's talk a little bit about that then.
Sure.
And let's use an example. I know that a lot of viewers out there don't have a primary care provider, and we really encourage them to get a primary care provider. But for those of that wouldn't have one, and let's say they think they're having some of those symptoms, or they're sick, walk us through what they should do with the urgent care approach.
Sure. So any of our respiratory type cases, upper respiratory, lower respiratory, whatever symptoms you have, we have been encouraging those patients to call that 542 SAFE number that's been in place since kind of the pandemic started. At that point, it's sort of a triage line, and that can sort of start that process. And that's what Dr. Maggard was referring to with that line, to get scheduled for your swabbing as well. That number can be utilized for that purpose. After that, you'll be directed to whatever urgent care is most convenient for you. And depending on what the purpose of the test is, if you've been seen already by your primary care provider, we'll do a car swab. If you've just been exposed and you don't have any symptoms, at that point, you can also have a car swab performed. Now, obviously, we're still doing the preoperative swabs at our urgent care sites, as well as a site on campus at the main Adena hospital. Now, if you are symptomatic and you have not been seen by your primary care provider, we have been bringing those people in to evaluate them prior to swabbing them, just for their safety if they were to have some other issues.
Okay.
So with I guess the difference between what the pediatrics department is doing, maybe other primary care providers are doing, obviously we're in the middle of a pandemic, so our wait times have been a little bit longer. So we are not putting respiratory patients in our waiting rooms. This has been implemented for the past several months, but we do have a car waiting service. So after you check in, you'll be directed to go back to your vehicle, give a phone number, and we will call you whenever it's time for your appointment. The other thing that's really important this time of year to remember is that we do have essentially a call-ahead waiting style system through the Adena Urgent Care website, which I believe is adena.org/urgent care. And you can actually reserve your spot in line through that and skip waiting in your car, potentially. Well, you'll still have somewhat of a wait, but skip the majority of that wait if you do so.
So tell me that one more time. I'm intrigued by this.
Sure.
Walk us through a little bit more detail about that appointment time. How does the patient do that?
Sure. So we have a system called Clockwise, which is implemented through that website. So what you would do is you would go on our website, to the urgent care website at Adena, and they have multiple little click boxes where you would select whichever site that you were wanting to visit at that time. You click that, and you can actually sort of schedule what time you want to be there, or if it's there's a wait already, it'll obviously push you back to whenever the next available slot would be. And it's really nice. It's a great system if you don't want to.
Has that been received well by the patients
Yes.
that have used it?
Oh yeah. It's waiting in your house in the comfort of your own home versus waiting in a potentially cold car this time of year.
Gotcha. Or feeling ill and also just staying separated from folks.
Correct.
Great service. Thanks
Sure.
for sharing that with us, Dr.
Absolutely.
Black. Appreciate that. All right. So we've talked about what are some of the nuances, what are the differences. We've talked about the flu vaccine. At some point, we'll have a COVID vaccine, so stay tuned. We'll provide you with lots of information there when that'll be available. But that's what we do if we catch it. I think one of the things that will be even more important is how do we not catch it, right? So Dr. Maggard, what precautions, particularly from a pediatric point of view, can we do to keep ourselves from getting either virus, COVID or flu?
Well, one thing we've talked about is the flu vaccine. Get your flu vaccine. That can help prevent your likelihood of getting the flu. And even if you do end up getting the flu, your symptoms will likely be much less severe than if you weren't to have the vaccine. So one of the best ways to prevent the flu is to get the vaccine.
All right, so get the immunization, right? And you mentioned all the way down to six months of age. Now, if they get the shot for the first time at 6 months, are they done for just the one time?
No, if they get the shot for the first time between 6 months of age to 8 years, and it's the first time they've ever gotten the flu vaccine, they do need a booster in a month or 4 weeks.
Okay.
Yeah.
So that first time, the kiddos will get
need two.
A back-to-back. Okay.
Right.
So we've got the immunization. We've done that. Now what do we do?
Yeah. So preventing the flu, like preventing COVID, like preventing other viral illnesses, there's a lot of the same ways. Washing your hands often. Try to avoid touching your face, your eyes, your mouth. Whenever you're coughing, cough into your arm. And if you're not feeling well, stay home. Yeah, there's some simple ways.
Awesome. What would be your recommendation? And this is challenging. We're in school, but school's different.
Yeah.
In so many different ways, from how we're playing sports to mask wearing to social distancing, and each school district is a little different as well. Any advice about if your child is experiencing symptoms and how do they handle? Walk us through that.
Yeah, so every school has a little bit of a different policy as to when to stay home or when to return to school. So they should have a set policy for you to be able to reference. But if your child's feeling sick, like cough, runny nose, fever, they shouldn't be going. Because like we've talked about with children, COVID can have really mild symptoms. So could a simple cough, runny nose, and sore throat be COVID? Yeah. So that's why you want to help protect others and keep them home. And if you're concerned, we can see them as well.
What are some of the dangers of influenza in children, particularly young children?
Yeah. So influenza, like mentioned previously, can be more complicated in kids than other viruses. Sometimes they could get pneumonia. Sometimes they could be dehydrated, require hospitalizations. It can even cause seizures, and in some kids, even death. Or sometimes it can be less severe complications like an ear infection, but it can certainly have a variety of complications.
You mentioned dehydration as one of the complications in children. I think as an adult, I understand when I get a little dehydrated, I get thirsty. But my child might not be able to communicate that to us. What are some signs that a child might be becoming dehydrated? Yeah.
So watch how much they're peeing. If your baby's not making as many wet diapers, if they're cutting back on their wet diapers, if your child's not potty trained or you're working on it, their urine looks more concentrated, and then watching just how much they're taking in. If they aren't drinking anything at all for you, or they're nursing less, they're taking less formula, those could be some signs.
Okay, very helpful. Thank you. Thank you so much. From an adult perspective, anything different, Dr. Black, as far as keeping us safe?
Sure. So essentially, just as Dr. Maggard suggested, all of the precautions that we're taking for COVID also apply to the flu. So the social distancing, the hand washing, the masking, all of those things are excellent. Not doing things that may be unnecessary trips out into the community, particularly once people start going inside. Outside activities are quite safe, especially if you're not within 6 feet of other folks. But once the winter starts happening, if you don't have to go out, we encourage you not to. And then another point too that I wanted to mention too with children going back to school it's really in having symptoms. It's not the children that will likely suffer from COVID symptoms, of course. It's the people that they would then spread that virus to. So it's those secondary infections that may occur if you were to send your child to school sick. Again, kids are most likely not going to die from that, but you have to understand many of the children in our communities that we serve are raised by grandparents. So those are the people that I worry most about whenever we hear about sending sick children to schools.
Awesome. Dr. Black, you and I, before the show started, we were talking a little bit about Australia, and you were doing some reading about the flu season in Australia. So for the viewers out there, you'll recall Australia is in a different hemisphere than us, so their winter is opposite of our summer. So they've gone through their winter season and they're entering spring. Yeah. Is there a possibility that because of all these extra precautions we're taking that we might see actually a more mild flu season?
I mean,
Can you explain what we were talking about there from Australia's point of view?
So Australia had pretty good response Australia and New Zealand both had pretty good response to COVID and social distancing, masking, shutting down non-essential businesses and things of that nature. And they really had an extremely mild, almost didn't have a flu season at all. So it's really encouraging that if we can continue to really, use good practices of social distancing in our communities, we can offset a lot of the COVID infections, but also a lot of the flu infections as well.
So I hope, as all of you out there that are listening, we will get through this pandemic. It will subside, and we'll be able to take these masks off and be able to go to birthday parties again. But I also hope that some of this residual practices we're doing about hand washing, right, and those things will stay with us to help just decrease the incidence of disease, because no one likes to have the flu. Anyway, it's miserable. So maybe there'll be a silver lining that comes out of this for sure. So we'll talk about there's urgent care, and thank you so much, Dr. Black, for walking us through that. Dr. Maggard, though, are there appropriate times that a child should be seen in the emergency room?
Yeah.
Can you kind of give the viewers some advice about how do they make that determination between seeing you, between seeing Dr. Black, or going to the emergency room?
Yeah. So with kids, if they look like they're starting to struggle to breathe, if they are working hard to breathe, you see them pulling to breathe, breathing really hard, they should be seen right away. That can be a sign of respiratory distress. And that's when I would get them in to be seen immediately. And the ER would be a great place for that. If we, and if we have availability, we could see them, but that's more of a critical sign. So that would be a good spot. Other things you could see, if we talked about the dehydration, if they aren't peeing at all, if you see anything that could look like a seizure, that, would be a sign that they should be seen right away. And it's important to know that our really little ones, if they're 3 months and under and they have fever, they need to be seen. They need to be seen right away. If our office isn't open, then definitely the ER, then urgent care.
Gotcha. So what's that age group again about when it's critical? 3
months and under. Okay. If they have fever, we want to see them.
So if a viewer out there has a child that's 4 weeks old, 4-week-old children should not have a fever.
Correct. Yeah. And the younger they are, the more critical. So I would say under 8 weeks, they need to be seen immediately. Definitely. Okay. And a lot of times they need more lab work, and that could be an ER visit. That 2 month to 3 month mark, that's when you could still be seen at your primary care, but you have to be seen. If they aren't open, that's when I would go to an ER.
Okay, very valuable. We do have a couple questions coming in, right? So Dr. Black, I'm going to ask you this one.
Sure.
Can you take a test to tell the difference between flu and COVID?
Yes, so we have had for years, had rapid flu testing, and now we are starting to get the rapid COVID testing as well. So a lot of times, I think in the near future, whenever that rapid COVID testing becomes available, it's likely that we will be swabbed for both, and we'll test for both. And if both of those are negative, theoretically, you have some other form of viral illness, which is less severe than those two.
So the medical community is learning a lot still as every day and every week goes by. For now, it's 2 separate tests. But there's a possibility that when you do get swabbed, it'll be in the future for both. Gotcha. Right. Okay. And then another question that's coming in, this one's for you, Dr. Maggard. Are kids tested differently than adults for COVID?
So right now, my understanding is that both are a nose swab. And I believe this rapid is going to be a throat swab.
Yes.
Okay, but my
So.
my understanding is that both are getting tested the exact same way with a
Gotcha.
swab.
All right, so kids don't go through a different procedure or
No, the only different thing would be if we've seen them in the office, we might be calling to schedule versus if they're right in the urgent care, they're right there.
Dr. Black, a question that's just come to my mind, is this something that a patient should be nervous about? Is it hard? Is it scary? Is it hurt? You know?
Yes, I was actually just getting ready to mention that myself. So I had this testing done about a month ago. I got a little cold, and of course, me being high risk, I wanted to be tested and protect my family. Personally, I would prefer getting swabbed than having my blood drawn. Not that I have a phobia of needles. I just slight discomfort. It's more strange than it is, painful, I would say. So no. Now they look menacing. The swabs do, which by the way, we do have smaller pediatric swabs for your children. So we're not going to stick a giant Q-tip down your tiny little baby's throat or
Okay.
nose. So you don't have to worry about that. But no, I'm not going to sit here and act like it's a comfortable thing to have done, but it's most certainly not something to be overtly, fearful of.
Okay. And the test actually only takes a couple of seconds.
Yeah,
Is that correct?
exactly.
To at least collect the specimen.
I would say no more than
Okay.
5 to 10 seconds total.
Okay. All right. So now let's as we're finishing up here, let's talk about someone's been to urgent care. You've done the appropriate testing. They don't have COVID. They do have the flu. They have a positive influenza test. Treatments. What medicines are out there, and when should someone take them?
Sure. So obviously, with all viral disease, anything that we would consider conservative type treatments or supportive care, hydration, rest, staying home, those things still apply for any of those things. Particularly for influenza, it depends on how long you waited to get tested. So if you start having flu symptoms, it is important to get in a little bit more quickly to be tested, because after a certain point, the treatments really don't affect your course of illness. Now there are now two treatments for influenza. Unfortunately, for one, it's only adults 18 and up as of right now, to my knowledge. I don't think Xofluza's for kids, but there is a new one out called Xofluza, and it is pretty
Say that
good.
again?
Xofluza.
Love the name.
Yeah, it is. It's catchy for sure. And that's been around. That was actually created in Japan. It had been around there for a few years, and but prior to it coming to America, I was like really ecstatic about how the results were, and it's been working quite well on our patients here too. I think it is starting to get covered now by more insurances as well. Now, of course, Tamiflu is tried and true, and that's what we do use for kids still, and it still works quite well, particularly in the pediatric cases where Xofluza has not been tested. But either of these medicines do really require you to be treated prior to that kind of 48 to 72 hour window to work more effectively and to reduce the course and maybe potentially the side effects of the disease later on.
So if a patient is in that time frame and they take one of the two medicines that you mentioned, will they feel better in 6 hours? The next day they wake up, everything's normal? What's the expectation there?
So particularly with Tamiflu, it does usually cut off the kind of the last couple of day or two of symptoms. I think Xofluza has really been shortening it even longer than that. So probably not within the next day, but it certainly should curb some of that peak of the 3 to 4 days when you really start to feel quite ill from a lot of these respiratory symptoms. It's usually after that first 72 to 4 day mark, and it'll kind of blunt that peak, I think, somewhat, especially if you're taking these other anti-inflammatory type medications like ibuprofen or Tylenol.
So Dr. Mag or Dr. Black mentioned that one of the medications you can give the pediatric population. Talk to us a little bit more about Tamiflu in the pediatric population.
Yeah, Tamiflu is antiviral. It's approved for children, but it's really important to start it as soon as possible. You have to start it within that first 48 or so hours for it to have an effect, and it can typically cut off the last 1 to 2 days of symptoms. But like any other medication, it can have some side effects. So I would say if you're interested in it and you're testing positive for flu, to discuss the risks and benefits about it with your provider.
Thank you so much, Dr. Maggard. I want to make our audience aware, speaking of flu vaccines, that you so both educated us about, Adena on Saturday, October 3rd, will host actually a drive-through flu clinic at our new Adena Health Center, which is located at the Woodlands location between 8 a.m. and noon. So for those of you who might not be familiar with the name Woodlands or with the location, it's in Chillicothe, and it's on the corner of Caldwell Street and East 8th Street. So I'll say that again. It's in Chillicothe. It's on the corner of Caldwell Street and East 8th Street. And it was the former location of the Meade Employee Health Clinic, for those of you who might remember that by that name. And it would be that clinic is actually open to everyone. And the drive-through shot clinic is available for anyone, and you don't need an appointment. So again, it's a drive-through shot clinic, Adena Health Center, on Saturday, October 3rd from 8 a.m. to noon. So Dr. Black, thank you so much. We are appreciative of the education that you provided us, particularly from an urgent care perspective and an adult perspective. And Dr. Maggard, always a pleasure to have you representing the great pediatric group that we have here at Adena Health System. We'll probably have you back at another time, particularly if we get that COVID vaccine, to educate how are we going to do that with the populations, et cetera. But in the meantime, we want you to stay tuned. In 2 weeks, we'll come back to you again live with Living Well with Adena, and we'll have guests that talk about breast health. October is Breast Health Month, and so we'll be discussing what every woman should know about breast health, and actually, believe it or not, what men might need to know about breast health as well. So join us at that time. Thank you very much. Thank you for our guests, and we look forward to speaking with you again in 2 weeks. Have a great day.